Hi, my name is Tomas Alejandro, and I will be explaining three things today. Is the PARQ test. I'm going to be explaining the importance of health and wellness, physical wellness, and I'll be giving my results on a Rockport walk test. All right. So the PARQs are basically called is another name for consent forms. A lot of doctors' offices use it. Um, Personal trainers, you know, physical therapists, anyone that practices as a doctor or a specialist use these consent forms not only to understand or see what type of health risks their patients are in, but they're also used to protect healthcare professionals. Okay, now a PRAQ form is basically the abbreviation for P, the recommended medical procedure. That's when you're trying to explain to your client or your patient. A, the reasonable alternative to recommend procedures. R, the risk of the procedure. And then the acronym Q represents the additional step of asking patients if they have any questions about the proposed procedure not adequately disclosed in the discussion. So basically, you're interviewing the patient, and you're asked, you have already done your diagnostics, whether it's X-rays, ultrasounds, or assessing their foot, hands, back, trying to figure out exactly what is wrong with that patient. I am actually a medical assistant and I work for a podiatrist and some orthopedic doctors. And what we do before we take any patient in the back is give out a consent form, especially the new patients. And in those forms, it gives a list of that patient's medical history, and they have to make a check mark whether if they have high blood pressure, neuropathy, um, cancer, any type form of arthritis, or if they're diabetic. So what it does, it just gives us an idea of what type of health risks and the reason why they're coming in to see us that day. So as a medical assistant for podiatrists, what I do is I will take x-rays, ultrasounds, and assist the doctors in steroid injections and explain to the patients different health measures they can take to prevent injury to the foot, because I work for podiatrists, so we do everything that's below the ankle, and basically to help that patient recover from whether they have tendonitis, bursitis, nerve damage, or loss of sensation in the feet due to neuropathy or diabetic neuropathy. Working as a medical assistant for the last 3 years, I have realized the importance of health and wellness, and that's the reason why I'm majoring in health and wellness. Health and wellness is basically everything. Um, it includes all the dimensions of wellness, whether it's emotional, social, physical, spiritual. It the health and wellness is basically just everything in a whole, and I enjoy it. And working for a podiatrist for the last 3 years, you see a lot of people come in with the same symptoms: diabetes, high blood pressure, neuropathy, you know, nerve damage. You know, a lot of times, patients would gain a lot of weight and they'll start having foot pains, tendonitis. It could be plantar fasciitis, Achilles bursitis, extensor tendonitis, peroneal tendonitis. A lot of things can affect the human body due to the type of lifestyle that you choose. So basically, at my job, I have to come up with preventatives for the patient. So, for example, say if a patient came in for heel pain, I would run the diagnostics, take the x-rays. We usually do 3 views. So we'll do AP, um, we'll do a calcaneal axial view, which is behind the heel at a 45-degree angle. And we'll do a lateral aspect, which is 90 degrees, pretty much all the way to the bottom. I'm trying to look at the lateral aspect of the foot to see whether they have any bone fractures or spurring or calcification of the bone, which can be, we're looking for like arthritis, anything, infection. If we don't see anything, we go ahead, we take them in the back and we go ahead and use the ultrasound. And with the ultrasound, we're looking for inflammation. And it's really just dark. It's going to show up as dark fluid. So what we do with that ultrasound, we go ahead, we go underneath the foot, which is plantar. We go underneath where the plantar fascia is, and we go ahead and make a measurement of that inflammation in the tendon. Now, what's normal for plantar fascia tendon, a measurement would be 0.2 or 0.25 millimeters. And normally patients that come in who have really bad tendonitis in that plantar fascia would come in there and they would measure about 0.5, sometimes 0.6, 0.7, to the point where it's so severe that a lot of times we go ahead and set them up for surgery. And that's why the PARQ assessment is so important, because we use that to explain to the patient the risk. We use that to, pretty much figure out if they are at risk before we even, let them know, like, hey, you need surgery. So PARQs are very important. It protects health professionals and it also protects the patient. Enjoyed that test because it really showed where I was, where I'm at physically. And I think that it's a great thing for both older and younger adults. Now, the walk test, I did pretty good at it. As a medical assistant, I put in about 14 to 16 hours a day. Not to mention, I also work for the Department of Mental Health at night. So, yeah, I put in a lot of hours. And doing a walk test, it really showed me that I should focus more on my BMI. Now, I'm a fairly big guy. I like to lift heavy. I don't do much cardio, honestly. But I've noticed, based off the assignments that we've been taking in this health and wellness class, I've realized that cardio and stretching is super important. And those 3 things, I think, can really improve one's, physical wellness. Stretching, exercise, and cardio is very important for you, for overall wellness. Now, like I said, I did fairly well. So I did 11 minutes and 31 seconds. in the walk with a 998 BPM. So I did pretty good. I'm very proud of that assessment that I took of myself. It's I really would like to improve myself more physically, but I'm pretty proud of the results.